Top 5 foods to avoid for high blood pressure. High blood pressure, also known as hypertension, is one of the most common health problems worldwide. According to the American Heart Association, nearly half of adults in the United States have elevated blood pressure. While medications are often prescribed, lifestyle changes, especially diet, play a major role in managing it. Certain foods can raise blood pressure because they affect blood vessels, fluid balance, and overall heart function. Avoiding these foods can reduce the risk of heart attack, stroke, and kidney disease. Here are the top 5 foods you should avoid if you want to keep your blood pressure under control. 1. Processed meats, bacon, sausages, deli meat. Processed meats are packed with sodium and preservatives. Just a few slices of deli turkey or ham can contain more salt than the daily recommended limit. Excess sodium causes the body to retain water, which increases blood volume and puts pressure on blood vessel walls. Research shows that regular consumption of processed meats is linked to a higher risk of hypertension and cardiovascular disease. If you enjoy meat, choose fresh chicken, turkey, or fish without added salt. 2. Salty snacks, chips, pretzels, packaged crackers. Snacks like potato chips and pretzels are convenient, but loaded with hidden sodium and unhealthy fats. A single serving can have 200 to 300 milligrams of sodium, and most people eat more than one serving at a time. Over time, high salt intake stiffens arteries and makes them less able to relax. Studies confirm that lowering sodium intake by just 1,000 milligrams per day can significantly reduce blood pressure. Healthier alternatives include unsalted nuts, air-popped popcorn, or fresh vegetables. 3. Canned soups and instant noodles. Canned soups, broth, and instant noodles often contain extremely high amounts of sodium to preserve flavor and shelf life. A single bowl of instant ramen can reach up to 1,800 milligrams of sodium, more than the recommended daily intake for someone with hypertension. Regularly consuming these products can cause water retention, bloating, and extra strain on the heart. Homemade soups with fresh vegetables, lean protein, and minimal salt are a much better option. 4. Pickles and fermented foods with added salt. Pickles, sauerkraut, and other heavily salted preserved foods can raise blood pressure due to their very high sodium content. Just one medium pickle may contain 600 to 700 milligrams of sodium. While fermented foods can have health benefits, excessive salt cancels out the positives for people sensitive to blood pressure changes. If you like pickled flavors, try making your own versions with less salt or use vinegar-based marinades instead. 5. Sugary drinks, soda, sweetened tea, energy drinks. It's not only salty foods that are dangerous. Sugar is also a major contributor to high blood pressure. Sugary drinks lead to weight gain, insulin resistance, and inflammation, all of which increase hypertension risk. Research published in the Journal of the American Heart Association shows that people who consume soda daily are more likely to develop high blood pressure compared to non-drinkers. Healthier alternatives include water with lemon, unsweetened herbal tea, or sparkling water without added sugar. Final thoughts. High blood pressure is often called the silent killer because it usually has no clear symptoms until it causes serious health problems. The good news is that simple dietary changes can make a big difference. By avoiding processed meats, salty snacks, canned soups, pickles, and sugary drinks, you can protect your heart, kidneys, and brain from long-term damage. Replacing these foods with fresh fruits, vegetables, whole grains, and lean proteins will not only help lower blood pressure, but also improve overall health and energy. Remember, every small change counts. Even reducing salt and sugar intake by half can lead to noticeable improvements within weeks. Always consult your doctor or nutritionist before making major changes to your diet, especially if you are taking medication.